Welcome back. If you joined us for part one, I'm so glad you're here for part two. And if you're just jumping in, you may want to go back and start there. Either way, let's dive in. I think you're exactly right when you say it can make doctors much more efficient and remove some of the tedious tasks. I mean, we could do a whole show about AI and in healthcare, in tech, in all the things, right? But I think one of the interesting things about thinking about AI in healthcare is how much more efficient it can make doctors and make your visits. Like, you're saying earlier, oh, we've got this 15-minute time frame. Well, if you're not taking notes, and there's another way that notes are being collected and collected thoroughly, and not something being missed, let's say, because you were writing and then, oh, I wanted to make eye contact with my patient because I don't want them to think I don't care. I think that there's a lot to be said for it supporting doctors providing the best care and showing up as their best selves, so that they can really focus on the patient, look in the eyes of the patient, talk to the patient, see what's going on, what are the physical cues that patient's giving them, as opposed to being
Yes,
head down, scribbling some notes. So
right.
I see it very positively, about how it can help our physicians and doctors do a better job, do a better service to their patients.
Right. You're spot on, though I do have caveats about it because I think we're in an age where there's so much hype and promise and pushing of AI, which I think it's good. I think we should push the edge of innovation, but I think we need to be aware of issues of responsible use. So as patients, we need to be aware that, of how our information is being used. So if my physician was using this system, I would ask, what happens to the recording? Where does it go? Is it associated with my personal health information? Can I not have you do this? Maybe I don't want you to record me during this session, right? So I think there has to be a balance with patients on the good, the bad, the ugly of AI. But to your point, it does show great promise. The medical literature, though, is kind of mixed when it comes to how much efficiency is really wringed out of using ambient AI scribes. I think it does show significant efficiencies, but may not show the return on investment that we all may be hoping for. So I think, again, innovation, this is all new. So I think these systems will be improved. I think the concept of not having physicians, typing when they should be looking at patients, because your point, there's a lot that we glean from just having that eye contact and observing the way a patient is sitting, how they're telling us things is so vitally important. I know to me that was super important in the emergency department. I got a lot of information just by walking in the room and seeing, what was going on in the room. So that I thought was a good point.
I love that you've had both the experience of peds and emergency. Is that a common experience for most docs? Do they usually typically move through different spaces, or is that something that's unique to you? Do you think most doctors have experienced a variety?
Well,
I'm On a
I
side note, I know we're talking about AI, but I'm just so curious
no,
about
no,
that.
no, that's good. That's good. It's a good educational point. I trained in general pediatrics, and pediatrics did a residency, but I did my fellowship, additional training in pediatric emergency medicine. So I did not work in a general emergency department. Most of my clinical time, for 25 years, has been in pediatric emergency departments. So my patients have been children. So it wasn't different fields. It was a subspecialization. I also did training in sports medicine and did a little bit of time doing primary care sports medicine, but these were additional subspecialty training. It's always been about children and their families. So,
I
yeah.
love that. That's so, like I said, probably this just the best. You want to just take care of those little guys and gals, in every way. But um, back to more of a technical side, you've said that health literacy is just as important as financial literacy, which is such a powerful statement because I think everybody goes, "Oh yeah, like I need to have financial literacy. Obviously, I've got to pay my bills. I've got to, create something for my family." But what do you mean by that? Why isn't this something we're taught earlier about health literacy?
Yeah. I think you said something at the top of our discussion that really resonates is that right now it is a top issue on people's minds because healthcare is not affordable. So that is all about finances. And we are, as you say, taught about how to do a budget. Maybe we're taught that. How to do a budget, how we need to squirrel away money for retirement, just kind of the household kind of stuff. But health and healthcare really impacts our finances. And if you don't know what your coverage covers, if you don't know about in network, out of network, prior authorizations, surprise bills, all of those things, it could really create a problem for you. So, for example, more than two-thirds of the GoFundMe's are people with medical bills. I mean, isn't that a sad state of affairs? And a huge proportion of bankruptcies in this country are due to medical bills, right? And right now, not to get political, but it's just a fact,
Yeah.
people are opting out of healthcare coverage because it's just so expensive. So, for example,
Yes.
for employers, it's like $27,000 on average to cover a family per year. And if you're a small business owner or not employed and you need to find coverage, it could be thousands of dollars a month, especially if you have healthcare problems. But people could be healthy. You could be a healthy 45-year-old. I run, I'm healthy, I take my vitamins, I eat right, but you're one car crash away from tens of thousands to hundreds of thousands of dollars in bills. So when people say you could go without coverage and pay out of pocket, that may not be something that is doable under those circumstances. So, health literacy is financial literacy. Health and health care really does impact our finances.
Well, and you've said it. I mean, I have heard so many people that have said, "You know what? This is crazy, this cost. We're going to skip it. We're going to opt out of healthcare coverage. And when we have to go to the doctor, we have to go to the doctor, but we're not paying because, let's say you're paying I don't know, $1,000 a month, $1,500 a month, you're paying, $12,000 a year, and you're thinking, well, if I could save that $12,000 and then go to the doctor one time in the year and it costs me $500, okay, I'll do it. But you are so right in that what happens when there's a car crash or what happens when you all of a sudden get sick and it's
Right,
some kind of genetic disorder you didn't know you had or that's come up later in life. These things happen all the
right.
time. And then
Exactly.
what?
Gambling. It's like going to the slot machine. And the other point too, it's not just the insurance premium that you're paying, but these are deductibles. And people to lower their insurance premium may choose what's called a high deductible plan. Meaning that you have to wait for spending of thousands of dollars before your insurance kicked in. So that's additional expenses on top of that. And people have to make that decision because gas prices are high, food prices are high, and so you have to balance your expenses. Most people cannot afford that $12,000 a year. It's we're in a very pivotal time in healthcare, and something has to happen in order to fix this health system that is really not helping a good proportion of our population.
What do you think? I know we talked about AI a minute ago, but is there anything that you really think people should be looking out for? Does it change how, I know you mentioned, that people could not have the recording going, but then you also said it can help physicians take better notes. So is there something that as a patient that we should be thinking about with AI, or is this just a conversation that different physicians are going to have with each other and how they care for their patients? Or is there something actually that patients should be aware of or thinking about?
Yes, that's a really fantastic question. I think there's a lot of really good stuff going on with AI that are helping physicians, right? AI is helping physicians read chest x-rays and CT scans. So they're helping radiologists. They're helping clinicians with decision support, providing information that physicians may need. Where I would exercise caution for patients, and I know most patients are doing this now, they're putting information or they're putting their symptoms into the ChatGPT or Claude and all of that, which I think is fine, but you need to understand what you're getting. It
Right.
may not be accurate. The system may be saying it confidently. Oh, your systems are showing you've got pancreatic cancer. Well,
Right.
and it could be wrong, and it's probably wrong. And so that would be one thing. So you can't just use these systems and say, this is the final diagnosis. I know I have this. And then you go to your doctor, I've got pancreatic cancer. I know it no matter what.
Right.
I think what AI can do, the positive side of this, is it can help balance that relationship with your physician. So it's you have some information, you come in and know what questions to ask your physician. But where I would caution patients, or I'd caution people, is absolutely do not put your medical records into ChatGPT or Claude. This has personal health information. Do not upload your stuff, your medical record, into any of these systems. I would not. We're not at a place where we can do that because you don't know where that information is going and how it's being used. So that would be the caution.
Yeah, I think that's a great bit of advice because I think sometimes it was like when Google first came out, it was like,
Yeah.
ooh, let me put my symptoms in Google and then I can tell my doctor, oh, like you said, I've got this or that. And now it's happening like in a more extreme way with the chat GPTs and all of that, where people are getting so used to talking to their now friend. A lot of people consider that they get kind of close with their chat GPT because they're telling it's talking to them in their language, and it's
Yes.
speaking to them how like a friend. And so I think sometimes when that happens, people just kind of start plugging all kinds of things in there. And it's like, whoa, 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 wait a minute. There are some things that you should keep out of there because just like you said, you don't know where they're going. And it could come back at some point somewhere and actually negatively affect you. So I do think it's a great tool for examining abstract ideas, but perhaps maybe keeping the exact details of all of your uh, every single detail of your medical record out of there is excellent advice, and I know everybody's doing it.
Everybody's doing it. But just think about how deceptive it is when you go into the GPT and it tells you, oh, it has this, and oh, don't worry about, it's kind of like it's talking to you like it's a human. It is not a human, okay? And the other thing you should think about, and I tell people this all the time, is those general GPTs, the Claudes, Chat GPTs, and what other systems, they're scraping the internet, right? They're scraping Reddit, right? So they're scraping information and learning from people who are posting stuff that is misinformation, wrong, and so on. So even if you put your information in there, I'm not dissuading people from doing it. It's just you need to know what you're getting. Putting your information in there and it's coming back with something with certitude, just remember where it was learning from, right? So
Right.
that's, caution.
Right. I really appreciate that because I do think so many people are doing that. I mean, we're doing it with everything.
Yes.
Forget about just not just healthcare, a recipe, a business decision. Everybody's using it for
Guilty.
everything. So
I do that. I asked for, actually recently, I said, I'd like to go on the Mediterranean diet, but I don't like this, that, and the other thing. Please come up with a 7-day Mediterranean diet plan. But that was a good
amazing.
use. That's a great use, right? And it's a healthy
Right.
kind of thing. I want to be healthier, eat healthier. So I think there are good uses, but just really be cautious and understand the limits is really, really important.
You're doing this work and preparing for your book release. I want to be able to tell the readers all, or the readers, the listeners all about what you're focused on right now, and how people can connect with you, and how can they find your book, and how can they find your website. So tell us all things. Just as a side note for all the listeners, all of this information will be in the show notes, so you can easily find everything that we're talking about here. But give us an idea of kind of all the things that you're doing.
Great. Thank you. I really appreciate this opportunity because this book was a labor of love because I really, really want people to be prepared and to have good outcomes. You know, as somebody who's led health systems, has taken care of patients one-on-one, and been, you know, a public health senior official, I really want people to be healthy and happy and all of that. So the way you can get this book, it's available for pre-order right now. It's available on Amazon. Just put in Adirim, the Prepared Patient, into Amazon, and it should come up. There's also Barnes and Noble, and then it's being published by Johns Hopkins University Press, so you could go to that website too. If you want a little more information about the release, it's being released August 11th. I do have a website. I am building it, but there's a website right now, thepreparedpatient.com, www.thepreparedpatient.com, and it has information where you can get the book, and how you can contact me as well. I love talking to people, whether it's on LinkedIn or people contact me through the website. I'm always happy to engage.
Awesome. Will you also be, will the book be available, like if for those that want to do through Kindle or through like Spotify or like a audiobook, is that going to be an option as well?
Great question. It is available by Kindle, hardcover, softcover, and I'm working with the publisher now about doing, whether there's a oral option. So not right
Awesome.
now, but hopefully by the time it's released, I'll know whether we could do something else, do a Spotify.
Awesome. Yeah, I love, I've got a stack of books on my nightstand that I'm like, okay, I got to get through those. But I also love it when they're available on audio, because as
Yes.
somebody that's like in a plane all the time or travel here, there, it's like, it's so nice when you can like put it on, take a walk, put it on the, getting on the airplane, etc. So I cannot wait to read this. I cannot wait to see all that you're doing. And again, all of this will be in the show notes so everybody can find it there. But I think what you're doing is such a gift, because again, it is so overwhelming. It's not even just about like what are my health care concerns, like not it's not just like what are my actual health concerns. It's like what is the whole bigger picture, and how do I navigate this crazy mess of a system right now, and especially when you're stressed about your health, stressed about money, having a guide is so wonderful and so needed. So thank you for the work you're doing. It's awesome.
But I
Um,
appreciate that. Thank you so much for having me on this really great podcast. I appreciated the discussion too. So.
well, we've got a couple more. So I want to do a more fun question about you personally. So you've worked in incredibly high stakes environments, and also fun fact, you've run 10 marathons. Hello, 10 marathons. That's amazing. What has that kind of endurance, both physically and professionally, taught you about resilience?
Thank you for talking about something I'm passionate about, though I'm not currently a long distance runner. But I think it's really taught me a lot. I think running marathons is hard. You can't just get off the couch and run a marathon. Nobody could do that. It takes work. It takes resilience. It takes planning. It takes mental fortitude, and it's working towards a goal. And so I think that's one of the things that it taught me, and that it translates into people either starting their career or middle of their career, that any kind of goal that you may have for your career takes work, right? It takes planning, it takes effort, it takes discipline. as well. And I think that's what marathons have taught me, because it's not really about the marathon, because, I've run 10 and most of them not, maybe didn't achieve my goal, but I think it was going through the process that was so enriching and important, and really taught me a lot. And I've been able to translate that into my career, because there is that saying, it's not a race, it's a marathon, right? So for most things that are worth getting to, it's worth putting in that effort.
That, and I'm so impressed by that. I when I was younger, I used to be a 10K runner, but I never got to the desire to do a marathon, but I'm so impressed by it. So I feel so impressed.
That's 6.2 miles. That's long distance. Most people can't run that. So that's good.
Well, it's been a while since I've done one. Okay, last question. At It's Not That Serious, we have a monthly highlight where we highlight women specifically and their stories, and it's called our WHIP series, and WHIP stands for Women in Power. But power can mean so many different things. When you hear that phrase, what does being a WHIP actually mean to you today, a woman in power?
Wow, that's a loaded question, because we're in some interesting times.
That's why I save it for last.
Yeah, we're in some interesting times. I think if you were to ask me this a few years ago, I might have a different answer. I think it's people, women in power, understand themselves, take advantage of situations, know when to pivot, and also know how to support others. I think in this particular time, and I hate to say this, and I've talked to a lot of women and they feel the same way, it kind of feels like women are being undercut a little bit. There was a kind of a period in the late teens, 2018, 2020, where women were hitting their strides, more women were ascending into leadership roles, and it feels like we're losing that now. Positional power, I think there's some loss there. But on the other hand, women then say, well, then I'm going to do it for myself, right? I'm going to become that person and do what I need to do in order to support my field, my family, or whatever that is. So I think I'm at a point in time now, I advise several healthcare startups. I do consulting. And I've written that book, and I have another book coming up. So, these are things that, I want to share with people. And even though we're in some rough times for women now, only 11% of women are CEOs of Fortune 500 companies, for example. Only 15% of academic medical centers are led by women. I mean, that is really, what does that say? I mean, and women have been, over 55% of medical students are women. 3/4 of healthcare personnel are women, and yet we can only, put men into these positions. There's something wrong here. So hopefully this is, over the next few years, things are going to get better. So that's my take on that.
Well, I am you are a perfect example of of a WHIP for whether that's in the INTS universe or whether that's just around the world. You are doing an awesome job, and we are so inspired by you and so lifted up by all the work you're doing, and so appreciative of everything you're doing to help people. Again, these are wild times, right? And I feel like as women, we really need to come together. It's the whole point of It's Not That Serious, is just bringing women together and lifting each other up. And so we are so happy to have you now in our It's Not That Serious universe. And again, everybody, all of the information that Dr. Adirim has talked about is going to be in the show notes. So please go to her website, get her book, and come to the It's Not That Serious website, get a shirt, get a mug, listen to the podcast, look through our Women in Power stories. They're really, really inspiring. And thank you so much for being here with us today. And thanks for coming on. And we'll see you guys next time. Bye. That's a wrap on today's episode of Carrie, It's Not That Serious. If this conversation resonated, subscribe and share it with a WHIP, a woman in power in your life. You can find more conversations, more community, and all the fun INTS merch you love at itsnotthatserious.com. We're building something meaningful here, and I'm so glad you're a part of it. Until next time, remember, it's not that serious.